It's been about 6 weeks since I had my radical prostatectomy, and if you've been watching my series of videos, you know that the operation itself went great, but they did find prostate cancer that was kind of unusual. It was growing on the outside in the fatty tissue that surrounds the gland itself. And after talking with my surgeon and a couple of other people around it, I thought it would be a good idea, if you're watching this, if you're facing or considering having prostate surgery. It was told to me that most surgeons don't have that fatty tissue that surrounds the prostate itself, have that in the pathology report. In other words, it's not looked at. And my surgeon luckily did look at it, and that's where they found that. Now, considering from my research that 20%, about 1 out of 5 people who go through the surgery, somewhere down the line start having a rising PSA, so basically the prostate cancer reoccurs at other parts in the body. So I'm just wondering, and so was one of the doctors I talked to about it, about how much of that, how many of those 20% could have known about that if their surgeon would have had the pathologist check that fatty tissue. And don't get me wrong, that fatty tissue is taken out anyway, so it's not that it's left behind. So if you're facing this surgery and you want to know, and that's a big thing, some people may not want to know, but if you're like me and you do want to know the whole story, probably before the surgery you can relate this story to your surgeon and ask that the pathologist check that fatty tissue as well as the gland itself, and then you'll get a complete story. I hope this has been useful for you, and please watch the rest of the series of my videos on prostate cancer. Thanks.